I'm Dr. Stephen Smith, an integrative medicine physician. I had a friend of mine who was going into the hospital for surgery, and they asked me for some advice about what they could take to improve their recovery. And I thought about this, and I have several suggestions. The first is minerals. I've done hundreds of trace mineral panels, and I've yet to find a single person that had good levels in all of the minerals. Everybody is depleted. So we have a product that is a trace mineral mix, and the normal dose is 1 per day, so I would take about 3 of those a day for about a week or so before your surgery to make sure you have plenty of zinc, potassium, selenium, and all those little trace minerals that you need. The second thing is vitamin D. I used to measure vitamin D levels. I quit because I've never found a single person that had a normal vitamin D level unless they were on supplements. So now I measure vitamin D, but only after people are on the supplements. I especially recommend this if you're going to have surgery. I'd take 50,000 units a day. That's a huge dose, I know, for about a week before the surgery. And that will get you up to a level of around 60 to 80, and you can go up to 100 is the normal limit. Costa Rican lifeguards have levels up to 150. I'd add some magnesium because almost everybody's a little bit magnesium deficient. And then I would take something that has glutathione in it. I've seen a number of patients that have been sick and tired for years after a long surgery. The longer the surgery, the more important this advice is. And that's a glutathione supplement. Now, glutathione is not well absorbed orally, so you have to take something that's enteric coated. The one I like is Recancostat. It was designed for cancer patients. It's enterically coated. I know it works. I've used it for over 20 years. And I would take the high dose of that. I would take a little bit before, but it's more important to take it after the surgery because that's when your body has to clear out that anesthesia. The risk is not so much the surgery, it's the anesthesia. The longer the procedure, the more glutathione you need. And especially if you're one that has MTHFR or another anomaly that limits your body's ability to make enough glutathione. You also want to take fairly high doses of vitamin C that helps with wound healing, about 4,000 milligrams a day. It should be sufficient. If you take too much, you'll get diarrhea, but most people can tolerate 4,000. And then amino acids, because your body's got to heal, and it makes protein to do that, and the building blocks of proteins are amino acids. So if you do those supplements, I think you'll find you recover a bit faster, and you'll get back, if you have brain fog or anything like that from the anesthesia, you'll clear that much faster. If you're really having trouble, you can find someone that can give you a glutathione IV, and just a couple of those will usually clear up the anesthesia fog if you have persistent anesthesia fog. We don't see it very often. When we do, it's usually fairly profound. So I hope those tips help and your surgery goes well.